Schizophrenia is definitely something that is portrayed in the media in a way that is not particularly helpful or is not how the medical profession would describe it. So it's often portrayed as a split personality disorder, which is not in fact the case. Schizophrenia is an illness that's characterised by delusions, hallucinations, disorganised thinking and behaviour, and also a cluster of what are called negative symptoms. So a psychotic episode is more an umbrella term, so describing a patient who has psychotic symptoms, and psychotic symptoms are delusions and hallucinations, and in general means that a patient has a very different sense of reality from others around them. Hallucinations can actually occur in all of our senses, but the most common one in schizophrenia is auditory hallucinations. And this means that patients who are experiencing auditory hallucinations are hearing things, often voices, that other people around them can't hear. And for the patient, when they are hearing these voices, to them their experience is as if they were hearing it from someone who was in the room with them. So it's very real to them, even though it isn't experienced by other people. A delusion is a fixed false belief, and often in patients who have psychosis, they are persecutory in nature. So patients often wrongly believe that they're being poisoned, for example, or they're being followed or targeted, or there is a conspiracy involving multiple different agencies or different kinds of people or groups of people to persecute them in some way. So they're often very, very distressing experiences. Drug-induced psychosis is a psychotic episode where the cause is very much linked to having taken illicit substances, and most commonly it's cannabis or marijuana or, at the moment, ice. Patients can have very, very different delusions and hallucinations, but some common themes are persecutory themes. Patients can sometimes misinterpret normal things in their surrounding. For example, often you hear patients misinterpreting car number plates or believing that what's happening on a television show or on the radio is a specific signal to them that they need to do something, or that someone else has done something, which then means they need to act in a different way. One of the other key symptoms of schizophrenia is what we call a cluster of symptoms called negative symptoms, and these are really debilitating. So patients become very apathetic, have reduced motivation, often really poor self-care, so they don't shower as often as they should, don't change their clothes, and these are, I think, often less distressing for the patient, but are very distressing for those around them, because they can really see that the person who they used to be really sort of change in front of them. So those symptoms and negative symptoms are really more challenging and difficult to treat. Really like to treat patients not only with medication, but also with talking therapies as well. In terms of medication, there are a number of different antipsychotics, some older ones, some newer ones. They have different side effect profiles, and often we have to try a number of different medications to find the one that has the best fit for the patient. Some of them are in oral form, so tablet form, and we also have a number of options in depot form, which is an injection of medication, and the drug companies have changed the formulation so that the medication is released over a period of time. And the benefit of this is that patients don't need to remember to take their medication every day, and it is often preferred by patients because they can get on with their day-to-day life without having to remember, and is also very useful in the group of patients who have limited insight into their illness, and so at times don't believe they need to be taking medication, but when they don't take it they really deteriorate, and so we want to keep them on medication so that they stay well. So how do you support your loved one who has a psychotic illness? I think this is really, really, really difficult. It's difficult working with patients who have psychosis, and it's really difficult for families who have family members who develop a psychotic illness. So I think that's the first thing to say, is it's not easy. I've got a phrase which I use often, which is that we're going to need to just agree that we're going to disagree on certain things. I don't find it helpful to challenge patients on their delusional beliefs, because the nature of a delusion is that it's a fixed belief that is unshakable. So getting into a to and fro about something they absolutely firmly believe is really unhelpful and not good for your ongoing relationship. So I recommend not to challenge them. Find the common ground, find the things that you do agree on, find the things that you both enjoy, be supportive, encourage them to take their medication, and also look after yourselves and make sure that you have enough support so that you can be there for the patient. And sometimes it is just too difficult, particularly when the patient develops delusional beliefs about family members. Sometimes you might just have to have a bit of distance and a bit of space and leave the professionals who are, that's their role, is to look after patients when they're very unwell, to provide that care. And when the patient is better and those delusions are less prominent, or hopefully have even dissipated altogether, then you can start to rebuild that relationship and work on that. But it definitely isn't easy, and looking after the family and making sure you have enough support is really crucial as well.